It's really important for women over the age of 40 to get annual mammograms. The main reason is because we can detect cancers so much earlier, and that gives you a better chance of survival if you do have breast cancer. Some cancers as little small as a pea you can't feel if you do monthly breast examinations. So it's really important that you get these every single year. When I found out that only about half the women who should be getting screening mammograms, who are women over the age of 40 in this county, are actually getting mammograms every year, it was really disheartening to me. Every woman over the age of 40 should be getting annual mammograms. Even if you don't have insurance, if you don't have a family history of breast cancer, everyone should be getting mammograms. It's not an excuse not to. We have great programs, community resources in the area that you can get your mammograms for free. All you have to do is ask your physician. The whole process is very easy to do. All of our mammographers are women. Everything's very private. The actual process takes maybe about 15 to 20 minutes. That's all the time. We take walk-ins too, so there's really no excuse. You don't have to come make an appointment. Just come right on in. We'll do your mammogram. Like I said, the whole process takes 15-20 minutes. It's usually done by all women. The compression is only maybe for a couple seconds, and the advantage actually with digital is that the whole compression time is actually smaller and less time, in addition to less radiation. So really, you have no excuse to come in and not have one done. There are so many benefits of digital mammography versus the old analog system. The best benefit basically is that you can look through the breast tissue a lot better, especially for women who have dense breast tissue or women who are younger, because they typically have more dense breast tissue. That helps see the cancers better and the calcifications better. And not only that, but we can manipulate the images better, not only us but the technicians, so that helps prevent people from having to come back and get additional images. And also, for when you're talking to referring doctors or surgeons, they can pull up the images on the computer just like we can, and we can help talk about and communicate, what kind of things need to be followed and what's the next step to help treat the patient the best. I'm very excited that we have digital mammography now. It's just more efficient for working through the process of patients. You can show the patients the images, you can call referring doctors about it. It's much more better to detect cancers and smaller masses and stuff. And the best part about detecting cancer early is that people have a better prognosis. And not only that, but for digital archiving and saving all the images, a lot of times women will go from one place to another place and you're waiting to get comparison films to be brought back. Everything is so much faster and quicker now that we have everything stored on a computer database. You can get those images much more faster. The American Cancer Society now recommends for women who have a significant risk, family history, or they have Gale assessment risk model tools that you can calculate. If you have a significant risk of developing breast cancer, you actually should be getting annual screening MRIs. And most insurance companies will pay for those now. So for women who have a significant risk factor, they really need to talk to their doctors about what's the best tool for screening. So a breast MRI is completely different. There's no radiation involved. You're actually laying on a table, and the whole process takes a little bit longer. It takes about 34 minutes to do, and you have to have dye in your arm and stuff to get it done. But it's the most sensitive tool we have for detecting breast cancers. It's 99% sensitive in detecting breast cancers, MRI is. Mammograms are only about 80% sensitive. So you're going to miss about 20% of breast cancers on a mammogram, and that's why it's so important to do monthly self-breast examinations. For MRI, we pick up every little thing that there is, every little cancer that there is the most sensitive thing. So for women who have significant risk of developing breast cancer, they should be getting screening MRIs every year.